Phentolamine is a reversible alpha-1 and alpha-2 antagonist, commonly used to treat pheochromocytoma and hypertensive tyramine crisis. In this scene, we'll cover everything you need to know about phentolamine to nail it on test day. Our scene takes place at a witch's house, probably somewhere deep in the forest. This witch was making some of her favorite alligator stew in her cauldron when a phantom rose from the stew in vengeance. Yep, take a look at that alligator-shaped phantom rising up out of the stew. Speaking of which, phantom kind of sounds like phentolamine, right? So, this is our phentolamine phantom. Looks like the phantom alligator is out for some vengeance, and the first thing it does is to knock over the cauldron of alligator stew. At Pixar Eyes, alligator stew is our recurring symbol for alpha-2 receptors. You know, alligator for alpha, and stew for the number 2. It's the alpha-2 alligator stew. The fact that this alligator stew is spilling represents how phentolamine works, by blocking alpha-2 receptors. So, putting it all together, that's a phentolamine phantom inhibiting the alpha-2 alligator stew. Looks like the witch was so surprised by the phantom rising up out of her stew that she's knocked over the seasonings that she was going to put into the cauldron. Which seasonings does she use, you ask? Well, obviously, she flavors the stew with her favorite sauce, A1 sauce. By the way, a bottle of A1 sauce is our recurring symbol for alpha-1 receptors. Get it? A1 for alpha-1 receptors? And this A1 sauce being knocked over represents how phentolamine antagonizes or blocks signaling at alpha-1 receptors. So, putting all of this together, this image should remind you that phentolamine blocks both alpha-1 and 2 receptors. You can learn more about the alpha-1 and alpha-2 adrenergic receptors in our dedicated videos on the G-protein coupled receptors. However, for now, it's worth noting that the alpha-1 blockade predominates. In other words, the blocking of the alpha-1 induced sympathetic response is the major means by which phentolamine works. Specifically, alpha-1 blockade inhibits vasoconstriction, causing vessel dilation and reduced resistance to blood flow. This reduced vascular resistance then leads to a fall in blood pressure. For some extra brownie points, it's helpful to know that phentolamine's blockade of alpha-1 and alpha-2 receptors is reversible, in contrast to drugs like phenoxybenzamine, which have irreversible effects. The differences of reversibility of blockade leads to some minor differences in the clinical uses of these two drugs, but I wouldn't spend a lot of time here memorizing these facts. The most important thing to know is which receptors phentolamine blocks, the alpha-1 and alpha-2 receptors. Alright, now that we know how phentolamine works, let's talk about how it's actually used in a clinical setting. See that phoenix in the back there? What witch wouldn't have a pet phoenix in the house? By the way, a phoenix is our recurring symbol for pheochromocytoma. Pheochromocytomas are neuroendocrine tumors, usually originating in the adrenal medulla that releases excess amounts of catecholamines like epinephrine and norepinephrine. In pheochromocytoma, this excess amount of catecholamines then activates alpha-1 receptors in the blood vessels, stimulating excessive vasoconstriction, which can lead to extremely high blood pressures. Phentolamine is useful for treating pheochromocytoma since a blockade of alpha-1 receptors can prevent the excess catecholamines from causing hypertensive crises. While phentolamine can be used for treating pheochromocytoma, it's worth mentioning that phenoxybenzamine is preferred in this context as the drug provides irreversible alpha blockade, meaning that the treatment effects will last longer. Next, see that mouse in our witch's hand? I think she was going to feed the phoenix with this mouse before the phantom came out of her pot. Let this mouse remind you of MAO, or MAO inhibitors. Specifically, phentolamine can be used to treat the hypertensive tyramine crisis that can happen with MAOI use. Let me explain how this works. Specifically, MAO stands for monoamine oxidase, an enzyme that breaks down molecules like norepinephrine, epinephrine, dopamine, and serotonin. MAO inhibitors block MAO, preventing the breakdown of these neurotransmitters, which is helpful in treating depression. However, when patients taking MAO inhibitors eat foods that are rich in tyramine, like aged cheeses or cured meats, This tyramine becomes a precursor molecule that is converted into neurotransmitters like norepinephrine, epinephrine, and dopamine. And what do we get with excess catecholamine neurotransmitters? Excess alpha 1 activation and hypertension, of course. This is why alpha 1 blockers like phentolamine can help treat these patients. Alpha 1 blockade prevents hypertensive tyramine crisis in patients taking MAO inhibitors. Got that? Before we close, we should briefly mention a few side effects. Specifically, phentolamine can lead to orthostatic hypotension and reflex tachycardia in patients. You shouldn't memorize this, as you can reason through it with basically no effort. You see, any drug that targets alpha 1 receptors to inhibit vasoconstriction will cause a decrease in vascular resistance that lowers blood pressure. It's quite logical that the treatment can take this too far and cause hypotension. As for reflex tachycardia, well, that's just the heart's compensatory response to low pressure. When the heart senses low pressure, it beats faster to pump out more blood, raising cardiac output in an attempt to raise the blood pressure back to normal levels. If you're having trouble with these concepts, just refer back to your basic physiology. And that's all we've got for phentolamine. Let's recap. Phentolamine is a drug that works by reversibly blocking or antagonizing alpha 1 and alpha 2 receptors. Blockade of alpha 1 receptors specifically causes reduced vasoconstriction, reducing vascular resistance and blood pressure. This mechanism can be used to treat hypertensive tyramine crisis with the use of MAO inhibitors as well as pheochromocytoma. Potential side effects include orthostatic hypotension and reflex tachycardia. Okay, let's get out of here and let our magical friends clean up this mess, and I'll see you in the next one.